Today, we turn our attention to a vital but often overlooked part of our health, our eyes. Globally, more than 1 billion people live with vision impairment that could have been prevented or treated. In Nigeria, access to affordable and quality eye care remains a major challenge. Many people suffer silently due to cost, lack of awareness, or cultural barriers that discourage regular eye checks. But there is hope. Health experts and advocates are pushing for greater awareness, earlier testing, and stronger policies to ensure that no Nigerian is left behind when it comes to vision. Because eye health isn't just about seeing clearly, it's about education, productivity, independence, and dignity.
So joining us now to discuss the barriers in eye care, I want to say hair care because we don't have a eye care access and how to break them down is Dr. Chibuzor Clement-George. She is the chairman of the Nigerian Optometric Association, Rivers State Chapter.
Good morning.
Doctor, good morning to you.
Nice to be here, and thank you for having me.
Thank you for joining us. I want to get started and just to describe the state of eye care in Nigeria in general. Talk to us about the stats we're looking at.
Okay, so we're using this opportunity of World Sight Day, which actually is going to be on the 9th of October, celebrated on the 2nd October of every year. We use it as a megaphone to create awareness on the much neglected organ of the body, which is one of the most important organs of the body, the eyes. So this year is still the same theme, love your eyes to the kids, love your eyes at the workplace, love your eyes everywhere. But this year, the major theme, the major focus is for us to personalize it. Globally, everybody is telling their stories, their eye health stories, their vision problem, how they got to know it. In Nigeria, okay, as part of statistics, in Nigeria, eye health is a very neglected aspect of our health care. Not much attention is paid to eye health. Statistics shows that in Nigeria, 1 out of every 130,000 adults is either blind or visually impaired. The last survey that was done in Nigeria was the serious survey, was the one that was carried out between 2005 and 2008 by in collaboration with CBM, Nigerian Survey on Blindness and Preventable Diseases. And it shows that awareness on eye health is very poor, is worse in geographical locations. The Northwest is more impacted, Northeast followed, and accessibility to eye health is better in the south area. The West, the Southwest have better access to health care. So looking at it generally, you can see that Nigeria is kind of left behind in the affairs of eye health in the global theme. Nigeria is the largest population in Africa, but statistics have also shown that our eye health, prioritizing our eye health and primary eye care is among the poorest. Is poor in the Sahel region and is very poor in Nigeria. So this year, we're also creating awareness, taking it to the policymakers, to the senators, to the government, federal, state, and local government levels to please prioritize eye health, make eye health affordable, make it accessible, and make it available to everyone, everywhere, irrespective of your financial status, irrespective of your social status. Eye health should be a right to every citizen.
Right.
Thank you.
So, Dr. Clement-George, you mentioned accessibility. So are you going to say that accessibility is the biggest barrier that is preventing Nigerians from getting proper eye care, or it's the cost or even availability of specialists?
Okay, the barriers to accessing eye care in Nigeria is multifaceted. is not accessibility is one of it, yeah, because if you get to the rural areas, you find out that there are barely any eye health or hospital. Even when they have the primary eye health centers, there's the dearth of optometrists and other eye care practitioners that can cover the whole area. So accessibility is one of the problems. Then illiteracy, lack of awareness, lack of knowledge is also a major problem. You have a lot of people not really being educated enough about eye health and the need to take care of their eyes. And when they have a problem, instead of seeking proper care, they go ahead to, seek traditional ways, put things in their eyes that will compound the problem. So then affordability also, a lot of people live below the poverty line. So going to access eye care will be the least of their problems. They are trying to just put food on the table. But if government can make this thing like accessible, like everybody's right, then you wouldn't be thinking of the cost. You just know that, oh, I have an eye problem and I can get to the nearest government hospital and access care. Thank you.
Thank you indeed. As we're talking about accessibility, we're talking about cost, we're talking about awareness. Let's also talk about, the early detections and regular checkups and, signs, common illnesses and signs that people somewhat ignore. Let's talk about them now that we're, raising awareness. What are some symptoms you would see? What are some signs that means you have to go, get checked and raise awareness regarding, or just, sound the alarm on early detection and regular eye checks for our viewers?
Okay, thank you so much for the question. The signs are not just one sign. It depends on the disease that you are dealing with. Example, somebody that has cataract, at the early stages, the person will be seeing as if they're seeing through a smoky or a harmattan vision until it continues to become very cloudy vision. That is a preventable blindness. When you have a surgery, vision can be restored. Then somebody that has glaucoma, the primary open-angle glaucoma, the normal tension glaucoma, really doesn't have any sign or symptom except at the very advanced stage when the person is already having a very reduced tunnel vision. That's the time the person will have any sign or symptom. But if the person is privileged to have access to care, at least once a year, access to care, then this blindness, because glaucoma blindness is irreversible, cataract is reversible. So this blindness could be averted. Then you talk about refractive error. That's mainly with the children. The signs are the child will not be seen, or if it's myopia, the child will not be seeing the board clearly or anything that is further away from them clearly. But if they don't know, they wouldn't even complain. If it's hyperopia, the child is not going to be reading comfortably because the child will be using a lot of accommodation to read. If it's astigmatism, they may have to be using their hands to keep prints in place. They could be having some itching. They want to go near the TV to watch it. They want to bring their books very close to their faces for them to be able to read. They keep rubbing their eyes all the time. So those are some of the few signs and symptoms that we could have. Redness of the eyes. They are all about it. A child having the head tilted a bit. Like you can notice that my head is also tilted because I'm an astigmat. Those are compensatory mechanisms. So if you notice, and a child that squints all the time, if you notice a child that squints all the time, most probably they're either short-sighted or they're astigmatic. So those are some of the few signs and symptoms that you could notice with your child or with an adult around you that will indicate that, oh, it's time to have an eye check.
Right.
And most of the things that actually happened, as I said earlier, are asymptomatic. They really don't have a sign until it's already too late.
So early checks are important, right? Especially for your children. So let's talk about it. Early detection, regular eye checks, what our viewers need to know.
Yes. Early detection for an adult is advocated that the way you go for your annual medical checks every year, and you check other parts of your body. It's the same way that you should go for your check for your eyes. The earlier you get something, the better. Somebody having glaucoma, you get it on time when you have lost maybe 60% of your nerves, and you manage it on time, then you're going to have vision for life. But if you do not go for eye check and you just buy glasses across the road from the person that is selling in the market, or you go to the market and assess care, they are not trained, they are not professionals. They're not going to do the needful. They're not going to examine. There's more to vision correction than correcting there's more to eye examination than vision correction. Vision correction is just saying, oh, I want to see clearly. But behind eyes, what is causing the eye problem? What is causing the blurred vision? What is the problem? The quack on the street wouldn't know how to tell you that. The quack in the marketplace wouldn't know how to tell you that. But if you meet professionals who are going to examine you, both external and posterior part of the eye, internal part of the eye, then they could detect things that, if handled on time, could save you agony, could save you early blindness, early visual impairment. And you know what that will cost you? Once you're visually impaired or blind, your independence is taken away from you.
Right.
You have to depend on people. Yeah, so we advocate annual checks for adults, and often regular checks as recommended by your optometrist or any eye care practitioner for the children who may have to be accessing care a little more frequently.
Right.
Thank you.
So, Dr. Clement-George, now let's talk about, we know that, Nigeria is one of the biggest countries in Africa, so we have a lot of people. Of course, we have also rural and underserved communities, and they have little or no access to optometrics or to get regular checks. What would you say what can the government do to bridge this gap so people can have, like you mentioned, it's supposed to be something that is accessible to everybody, it's more like a right. What do you think the government can do to bridge this gap? Dr. Clement-George?
Okay, thank you so much for the question. Governments have... Am I audible?
Yes, loud and clear.
Okay. Thank you so much for the question. Governments have already set up primary health centers all over the local government areas down to the wards. All that needs to be done is to equip those eye centers, like primary health centers, to have eye care centers in them. Incorporate primary eye health as part of a health policy. We don't have it as a health policy, so that is a big issue. If you have it as a health policy, and then is in the primary health centers, have eye care and optometries, and sometimes you may have to post shoes to unaccessible areas, and then eye care center, optometries, ophthalmologists, and ophthalmic nurses are posted to those places. Even if it means going there once a week, it's better to go to all those unaccessible areas once a week than not going at all. So if government should institutionalize it, that eye health becomes part of primary health, then it will policy will trickle down to the ward area. But eye health is not prioritized. Is not been made as part of the primary health. Even when it's insured in insurance, you see that things that are given, things that they'll say, oh, this is not paid for, this is paid for. It makes it, even the people that are already insured, they are not having the comprehensive eye check and eye health that they should have. So government, we are advocating, using this medium to advocate that government should institutionalize eye health as part of primary health. It should be part of primary health care in the country. And when it comes to children, we're also saying for kids, as is done in other climes, a child should have their first eye check at least before entering kindergarten. 78% of what we learn, almost 80% of what we learn is through the eyes. a child that does not know any better and is visually impaired by myopia, high hypermetropia, strabismus, that squints, and the child is in class. Whatever the teacher is writing on the board, the child is barely seeing it. And the child will never know because he has never known anything better. So the child will just keep on being a dull child in the class, whereas he's not really dull, and all that. And well, if the teacher is not aware, the teacher may not also be aware to tell the parents that this child needs care. So if government should also make it mandatory that a child should have their first eye check by 4 years. Actually, it should be earlier, but at least by 4 years before they enter kindergarten, to check whether they have any refractive error that needs to be corrected and they regain their vision, regain their life, regain their learning abilities back, or do they have color vision abnormalities that could be corrected so that when they are teaching them in color-coded teaching, the teacher will understand that this child may not recognize red, will not recognize blue,
right,
will not recognize yellow, and then we know how to handle the child.
Okay.
So,
Which makes sense if I think about the kid that was beside us, rather, who was my classmate in primary school. No wonder he always wore a different color of socks every single time, and he always called brown gray, or was it red? Quite interesting. Anyway, Doctor, I wish there was enough time for us to have this conversation, but healthcare is a recurring discussion that we'll continue to have. The primary healthcare centers are there, but more needs to be done in terms of policy enforcement, but most importantly, funding when it comes to testing at the early stages and also for the elderly. Doctor, thank you so much for coming on. I appreciate you for doing this with us. Dr. Chibuzor Clement, once again, thank you.